Welcome to Duke Spine Institute, September 25th, 2025. Our patient comes from Nebraska. He's had a spinal fusion in the past, L4-5, L5-S1. It looks like L3-4 may have been fused. It doesn't appear to have much disc left. He has developed adjacent segment disease. What does that mean? He now has problems above his fusion. If his fusion was at, let's say, 3-4-4-5-5-1, now he's got pain and degeneration of the disc and facets above that. So we've got pain up at L1-2, 2-3, probably 3-4 shot. But we're going to go in there and fix that for him, okay? How do we do that? Well, I'll have Henry show you how we do it.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Sean? Sean? All right, welcome back. You can see from our animation that we are going after something called the medial branch of the dorsal ramus. It's a pain nerve that is located in the back of the spine, right where the transverse process meets with the superior articular facet, just a little bit medial to where I am right now. Sean, he's got pretty bad arthritis of that facet joint. You can feel it. This is where he had his fusion too. So there's a lot of onlay bone graft here getting in my way. I can feel it. So he was definitely fused here. Any questions, Sean?
At this moment, no current questions.
All right. Yep, very abnormal bone. Just about done. Probably another minute, Sean. That's the last transverse process right there that we need to treat on it. All right, well that should do it. Matt, I'm going to go back just one more time to the one above shot, just to make sure I got it good, because that was the weird one. Shot is not feeling normal. You can see some abnormal bone. All right, I can feel like that medial branch is covered by bone, but I think I got it. We should be good. He'll be sore probably for a week after the surgery, just from the surgery itself. It's pretty normal to be sore. We put a little numbing medicine in there to help ease the pain. But you see the whole thing is done with a 4mm incision. All done. This is a new way of doing rhizotomy, but it's a permanent rhizotomy. Okay? There's his Duke plasma rhizotomy incision, 4mm. Then he's got the Duke laser disc repair incision, 7mm. And this one is about a centimeter. Nothing. Great job, team. Thanks for joining us. We have one more patient who has a 5-level lumbar DLDR. I'm here with one of my post-op patients. We get a lot of requests for Dr. Duke. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Duke laser disc repair done at L34, L45. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Duke Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Duke Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3, 4, 4, 5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy. It
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
Outpatient. There was no bleeding.
And no pain from the surgery.
No pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery? I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us. And you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome.